Our next presenter is Dr. Rebecca O'Reilly from the School of Nursing and Midwifery. Rebecca has a PhD from Western Sydney, and her presentation this afternoon is titled Domestic Violence, Building Healthcare Providers' Capacity to Screen and Intervene. Please join me in welcoming Dr. Rebecca O'Reilly.
Yep. Domestic violence. 1 in 4 women will experience domestic violence in their lifetime. On my slide, you can see the multidimensional nature of domestic violence. Its reach is far beyond physical abuse. With that in mind, it's likely that a woman in this room, or a woman that you know has or will be a victim of domestic violence. This significant global public health issue is underreported, has intractable consequences of morbidity and mortality for women and children, and costs the Australian government over $13 billion annually. Yet women are not being adequately screened for domestic violence by all healthcare providers. Domestic violence screening involves starting a conversation with women in their care, asking questions about safety at home, and also being alert for red flags and risk factors. My research has revealed that community-based healthcare providers in Greater Western Sydney face considerable barriers to screening for domestic violence. These include a lack of resources, a lack of confidence and knowledge, a lack of time, and uncertainty regarding best practice. I've built a strong research team, and our preliminary research revealed that very little has been done to address these barriers. Currently offered training on domestic violence screening is lengthy and may require face-to-face attendance. For many healthcare providers, leaving their busy practices to attend workshops or undertake lengthy online modules is simply not an option. I wanted to do something about this, so my research team and I held an evening forum that was funded by the Urban Living and Society projects, and it was attended by some of the key research stakeholders you see on the slide, as well as end users and researchers in this area. The findings from my previous research were shared at the event, as well as my idea to develop, implement, and evaluate an innovative, interactive online education package on domestic violence screening and intervention for GPs, RNs, and midwives. Using a collaborative workshop approach, we were able to gather vital feedback and expert opinions on what was needed to move this project forward. Thus began my journey of a high level of engagement with representatives from the key stakeholders, end users, and researchers. This continued after the forum, with referrals shared with me to make contact with other key researchers and end users. Between the workshop and my ongoing engagement, I've established an amazing team of experts, including research professors, midwives, nurses, GPs, and representatives from ANROS, Anglicare, and the White Ribbon Foundation. Through my engagement, I was also invited to attend a one-day workshop on the impact of violence and action for intervention at the Hunter Medical Research Institute. And at this forum, we've developed a Women's Abuse Recovery Network, and together we are going to write a joint submission in response to the National Women's Health Policy Review. The team of experts I have gathered were engaged at the start to co-design the online education package, which will consist of 10 mini modules of 5 minutes duration each that will guide the healthcare provider to what to look for as red flags and risk factors, how to ask the questions about domestic violence, how to respond appropriately, and most importantly, healthcare provider self-care. An expert advisory panel reviews and provides feedback on each module as they're developed. This innovative project addresses the Australian Government National Action Plan to increase early detection and intervention for domestic violence, as well as the key barriers to healthcare provider screening, such as the lack of time, inadequate education, and lack of knowledge and confidence. Never before has there been an online training system that is targeted at GPs, RNs, and midwives together. But yet, working with women who experience domestic violence requires an integrated, multidisciplinary and multi-agency response. Another key distinction of our online learning modules is the ability of each module to be completed in 5 minutes duration while still requiring informative information. My research team and I will be hosting an evening launch of the education package with the expert panel, advisory panel, key stakeholders, end users and researchers all invited to come along and help promote the recruitment of the piloting of the project. I'll also use key social media sites such as Facebook and Twitter for recruitment. With so much already achieved, the potential for further impact is strong, and it includes the ability to reduce the health impact and economic costs of domestic violence. It can also change healthcare provider practice by developing their capacity and building their confidence to screen and identify for domestic violence early, which is also in line with the National Action Plan. But most importantly, this intervention has great potential to save lives. And I ask you, what could be more important than that? Thank you.
Thank you very much, Rebecca. Questions, please. No, I thought.
When's the launch?
Do you want to come? I'm happy to invite you. It will be early next year. Yeah. So at the moment, we're currently working on finalising the modules. I'm very lucky to have a research assistant who's an experienced medical writer in my team, and I have a blended learning designer in my team. So we're in the process of writing all of those now, and getting them ready for the online format. Yeah.
And have you got students involved in the project?
So no, I haven't got students involved in the project, but that's something I could definitely consider for the future. At the moment, I'm not looking at targeting undergraduate education with the program. It's really for community-based healthcare providers, but there is definitely potential. I actually presented it at a conference in Canada 4 weeks ago, and I had a lot of interest from from a university in Canada, but also someone in Queensland who would like to try and introduce it and adapt it for their undergraduate courses. So definitely potential for that.
Okay,
Hi.
thank you. Thank you for your very nice presentation. Can you tell me that what kind of program are you adopting to control this violence? And which individual, male or female individuals are more targeting, which individuals are?
Oh, sure, yeah. So my program is actually going to be in an online format, and it's actually for healthcare providers. So it's targeted at healthcare providers who will be working with women. We know that primary healthcare providers are in an opportune position to work with women who may experience domestic violence. And the reason why I'm choosing primary healthcare providers in the community is because they do work with families and women long term. They develop rapport with these women, so they're more likely to be able to identify the red flags and to ask the questions once they're comfortable with the women. So that's the audience that this is being targeted at this stage. Does that answer your question? Yes?
Can you please join me in thanking Rebecca O'Reilly?